My name is Dr. Jason Branch. I am a assistant professor at Monmouth University in the professional counseling department in Long Branch, New Jersey. And I'm starting something different, something new. And this is my first video, mentorship. This is mentorship through distance. So anyone's listening, thank you for checking out my channel, thank you for checking out my page. Something I was willing and interested in doing. I do a lot of mentorship. I love mentorship. To me, mentorship is a way of life. It's how I have gone so far in my career and my life is because of mentorship. So everything I do is for the benefit of other people. And I'm just trying to do my best at being the best version of me. So hopefully these videos can help you be the best version of you, give you some tips and tools to help you throughout your career. As a person who may be interested in a doctoral program, maybe in a master's program, maybe in high school, undergrad, college, maybe in a doc program now, maybe even a faculty now, wherever you are, whatever you're doing, hopefully these videos will be able to assist you. So the reason I started doing these videos, I thought about this when I was in my doc program. Just a little bit about my background. I got my master's, well, my bachelor's in, let me just go all the way back. This is in real time and I'm not gonna edit it. We're just gonna talk. That's what we're gonna do. So I'm originally from Dayton, Ohio. After Dayton, Ohio, I left after high school, moved to Alabama, and went to University of West Alabama to get my bachelor's. Got a dual degree in psychology and sociology. Left University of West Alabama, got a job in mental health counseling, doing in-home. Did in-home at JBS Mental Health in Birmingham, Alabama. Did that for a few years and then decided to go back and get my master's. Got my master's in clinical mental health counseling from UAB, University of Alabama at Birmingham. Finished that. And after I got my master's, went right into private practice. So graduated in December, I was in private practice by April. So it's possible. If I can do it, you can do it as well. So my background is in counseling and mental health. I've been in the profession for about 15 years now. And then got a chance to teach as an adjunct. I worked in the profession for years, got a lot of clinical experience, and then taught as an adjunct at the same program that I graduated from, UAB. And after I graduated from that program, I decided that I just wanted to go into private practice. That was it. That's the highest level that I wanted to go. And then I taught as an adjunct. And when I taught as an adjunct, I found out that I like teaching as much, if not more, than I like counseling. And that's what made me decide, maybe I want to go further, get my PhD. And so I went back and got my PhD in counselor education and supervision from Auburn University, War Eagle. So it's a little bit about my background. As we get to know each other and progress forward, I'll share a little bit more about me. So the purpose of these videos is for me to help you from afar. We don't know each other yet, but we will get to know each other. And I just want to help. I just want to support. So this idea came from one of my mentees, Janelle Jones, who's at University of Alabama. Shout out to Janelle for his video. We had a conversation recently and she was just talking about the struggles of being a doc student, struggles of being a doc student, being a Black female and predominantly white institution at the University of Alabama, and the struggles, the everyday struggles of being a doc student, and how even more difficult it is being a person of color in these programs. So that's kind of was the last straw for me of, I gotta make a video, I gotta talk about this stuff, because it's been something that has plagued a lot of doc students for several years. The ups, the downs, the dramas, the goods, the bad, everything. And I feel as though oftentimes we don't really have anybody to talk to about it. Oftentimes we don't have people who are transparent, who's honest, who's open, who's authentic to share their experiences and give some guidance and support. Fortunately for me, I had some great mentors over the years. Also for me, unfortunately for me, I've had some really bad mentors. I'm talking about horrible. They were really, really bad. So because of those experiences, the good ones and the bad ones, it helped me become one of the best mentors that I feel as though I could be. And now I have a small group of mentees that I've been working with, and now I want to stretch. I want to make a larger reach, further reach to people that I may not have ever met before who probably could just use some mentorship directly and indirectly. So I make myself available to you, the viewer who's watching this right now. So welcome to the channel. How this works, typically I'll get on here whenever I feel the need. I'm not finna say you can find my video once a week. Not finna do that. That's not how it works. So you get a video whenever I send a video. It's kind of how it works. And in that video, it may be things that I'm dealing with currently, what a mentee may be dealing with, something I hear about. It's just in real time, whatever I feel, whatever I think, it comes out in a video. So I don't know how long I'll do this. I don't know how many videos you get. Doesn't really matter. I'm just gonna put myself out there and make myself available to you. So, welcome. This is my introduction video, just giving you a little bit about who I am and what we're here to do. Appreciate you tuning in. So one of the things that comes to mind for me as far as being a doc student in a PhD program, any PhD program, is how things change. Meaning, whatever you did before you got into your doc program, that was your life. That's what you did. It was easy, it was normal. It may have been hard or whatever it was. It was a system that you created. And within that system, it worked. Whatever that system was, if you were working full time, if you were in school, it's a system you created that worked for you. This is how you lived your life. Then when you transition into a doc program, especially as the first year, you have to create an entirely new system, a different system that you have to create in order to manage in a doc program. From my experience, I worked as a clinician for several years prior to going back to get my PhD. I was actually in the field for 10 years before going back. I've been out of school for about 5 years before, no, 6 years before going back to get the PhD. So I was grown, I was working in the profession, making great money, and then gave it all up to be a student. And so going back into student mode, it was a lot of changes that, number one, I had to humble myself. I had to humble myself a whole lot because when you're working in a profession or an industry and you're making a lot of money and then you become a student and you're living off of a stipend, you're living off an assistantship, it makes life a lot harder. And then you're managing personalities. That could be personalities within your cohort, personalities within, professors, or just navigating different spaces, being on a college campus. Those come with all types of things itself. But as you make that adjustment, make those changes, you find a system that works for you. As soon as you find that system, typically you find it in your first semester or so, then the next semester comes, guess what? You got to design a whole new system. Every system that you use each semester, you can't keep the same system. You have to continue to redevelop yourself and reestablish a new system, because what worked for you first semester may not work for you second semester, third semester, fourth semester. Or what worked for you first year may not work for you second year, third year. So it's about systems. It's creating a system that works for you. Understand that a lot of these systems that you create come from beliefs and ideas. All of us, many of us, let me reframe, many of us have had ideas of what it's like to be in a doc program or be a doc student. And those ideas typically are skewed as soon as we step foot on campus and we realize these ideas does not match the reality of being a doc student. Being a doc student is a lot harder than I thought it would be. And navigating so many different things is beyond just what you do every day in the classroom. So a lot of my perspective I'm going to speak from comes from being a doc student in a counselor education program, being a non-traditional student, meaning working for several years and then returning to school, being a lot older. I was a lot older when I started my program, and just my mindset was just very different from a lot of people that was around me. But with that different mindset came great challenges and things that really worked well for me. And then there were other challenges that weren't so great. That was really difficult for me. So let's dive into this journey together. This is just a quick intro. You're more than welcome to ask any questions you have related to what you may be dealing with your experience. I'll get back to you as quickly as I can, as best as I can. I'll do my best to respond to every question that you may have. Again, I don't like work. I don't believe in work. So to me, if you love what you do for a living, you never work a day in your life. I haven't worked since 2005. And me having a YouTube channel and creating these videos isn't work. This is just me giving. So when it becomes work, probably not going to do it anymore. But I want to help. So feel free, ask away. What questions do you have? Any questions you have, will probably make it into the next video. And if there are no questions, I'll create things. That's kind of how this works. So Look forward to this journey with you. See you soon.